Global emergency declared over a new Mpox outbreak. What to know in Florida. Enjoy unlimited access for 99 Save Healthcare. Global emergency declared over a new Mpox outbreak. What to know in Florida by Michelle Marcanter. The World Health Organization has declared a global health emergency for Mpox, formerly known as monkeypox, as concerns mount over the spread of a more contagious form of the virus that has fueled a surge of cases in Africa. The declaration comes a week after the U.S. Centers for Disease Control and Prevention issued a health advisory stating that while the country's risk for the more severe form of Mpox is low, doctors should have a heightened index of suspicion for Mpox in people who recently traveled to affected countries. On Thursday, Sweden confirmed a case of the more contagious strain of Mpox. Types of monkeypox. There are two types of Mpox. Clade I, a more contagious form of Mpox that tends to cause more severe illness and death. It is endemic to Central Africa. Scientists earlier this year reported on a new form of Mpox in a Congolese mining town that can kill up to 10% of people and may spread more easily. According to the Associated Press, clade causes less severe infections and is what fueled the 2022 global outbreak that led to more than 32,000 infections in the United States. Federal and state health officials are still recording cases of Mpox in the U.S., including in Florida, but none so far are caused by the more contagious clade I strain fueling the wave of infections in Africa, according to the U.S. Centers for Disease Control and Prevention. There have been more than 1,000 reported cases of Mpox in the country this year. CDC data shows Florida has reported more than 100 cases this year, with more than half involving South Florida residents, according to preliminary data from the state's reportable disease surveillance system. The first thing that I would tell people is not to panic because at this point there have been no clade I cases in the United States. Right now our risk is low, said Carrie Debink, an associate teaching professor in the Department of Molecular Microbiology and Immunology at the Johns Hopkins Bloomberg School of Public Health. I think the WHO making their declaration that this is a public health emergency of international concern is really a warning that this is a potential problem, but there's still time to prevent it from having global spread. She said people who are considered most at risk for severe infection